High blood pressure or hypertension is very common these days. You must have heard many people saying, I have BP. Every individual has blood pressure, which is required to move the blood forward in the arteries and which helps in the supply of oxygen to the tissues. Normal blood pressure is 120 by 80 mm of mercury, where 120 is systolic and 80 is diastolic blood pressure. WHO defines that if the systolic blood pressure is above 160 and diastolic pressure is above 95, it is said to be hypertension. If the diastolic pressure increases above 100, then it has to be treated with drugs and diet. Hypertension is not a disease, but it indicates that some underlying disease is progressing in the body. It may be cardiovascular disease, renal disease, or tumors in the brain, or adrenal glands, hyperthyroidism, or diseases in the ovaries and pituitary glands. The factors of hypertension are hereditary, stress, obesity, smoking, high viscosity of blood because of increased number of RBCs, narrowing of the blood vessels because of the hormones like cortisone, aldosterone, and hypertension may be mild, moderate, and severe. In mild hypertension, the diastolic pressure is between 90 to 104 mmHg, and the treatment will be weight loss, sodium restriction, and behavioral techniques. Moderate hypertension is between 105 to 119 of the diastolic pressure, and here again the sodium restriction along with the drugs is prescribed. If the diastolic pressure is between 120 and 130, then along with the treatment, some vasodilators also are given. Many persons with hypertension will not have any symptoms. Headache, dizziness, impaired vision, failing memory, shortness of breath, pain over heart, gastrointestinal disturbance, and unexplained tiredness are some symptoms. Diet should be low calorie, low fat, and sodium restriction with normal protein intake. All the processed food should be avoided and salt restriction should be done. There should not be any table salt. Dry fish should be avoided. Baking soda and Ajinomoto also should be avoided. Sodium intake should be less than 500 mg per day. It's very important to take care of hypertension.